Doctor, I would want to get some expert insights from you. And to begin with, I would want to understand about what motivated you to get into this field and how has your journey been so far. Over to you, Doctor.
When I was a kid, I remember my class teacher asking me what I wanted to become when I grow up, and my answer was I wanted to be a heart surgeon. Well, I did not know what it takes to be a heart surgeon, but I surely knew that I wanted to be a surgeon in my life. And as the journey of life traversed and as I grew up, I ended up being in the medical school. And once I finished the medical school, the choice was placed in front of me again whether I wanted to get into a surgical field or non-surgical field. And I was always sure that I wanted to be a surgeon. I used to enjoy drawing and painting, and I used to, pay a lot of attention to my handwriting. And I knew that I can do something with my hands, and that prompted me and inspired me to be a surgeon. And when I did get the opportunity to eventually pick cardiovascular surgery, there was no second or third choice. It was my life's dream and passion to be a cardiac surgeon.
Doctor, your journey has been very motivating for budding surgeons as well. So, but you must be faced with a lot of challenges as well along your way. So, we would want to know about your challenges and how you tackle them differently.
Well, challenges are always there in all fields. It depends on how much drive and passion you have to achieve what you want. It is always a long and arduous journey to reach where you need to be, and nothing comes easy in today's life. Everything comes at a cost. The higher you want to get, the bigger the price you pay in many ways. But what's important is to keep the fire burning in you to reach a certain level that you have dreamt of and that you have always had the ambition to become. So it's important to keep the passion and the motivation going.
Since you had the aortic surgeries at Apollo, what specific types of surgeries do you specialize in? Do you want to talk about that?
Yes. So I'm a heart surgeon, but I specialize in aortic surgery, which is a notch more complicated than regular heart surgeries. As we all know, aorta is the main blood vessel that carries blood from the heart to the rest of the body, which includes the brain, hands, legs, intestines, liver, kidneys. So it's a multi-systemic involvement. That is why when there are diseases of the aorta, which is the main blood vessel, it becomes a very complicated affair because you have to manage multiple systems in the body, and it's imperative to have adequate knowledge about how the brain works and how the kidneys work and how the intestines work. So apart from being a cardiac surgeon, I have to be a comprehensive surgeon to really treat these complex diseases. I noticed about 10 to 12 years ago when I joined for my fellowship in vascular surgery that there was a severe dearth of comprehensive aortic surgeon in India. There was in fact no surgeon in India who could manage the entire aorta, be it in an open surgical manner or an endovascular surgical manner. That was the need of the hour in our country. Now that we have the highest population in the world, and we know that heart diseases are the number one killers worldwide, there are aortic diseases on the rise as well. And it's the right time to have an aortic surgeon as a specialist in our country who can treat these diseases in a comprehensive, unbiased manner.
Thank you, Doctor. So I would want to understand, how do you stay updated? You told us that you need to be a comprehensive surgeon. Yes. How do you stay updated on the latest advancements and techniques in aortic surgery?
See, first and foremost, to be an aortic surgeon, it takes a long time, many years of training, practice, experience. I was fortunate enough to complete my training in India in both vascular surgery and cardiac surgery, which was a total of 5 years. And I was selected for multiple fellowships in Australia, in Canada, and I worked at Cleveland Clinic, Abu Dhabi, where I did majority of my training in aortic surgery as well as gained considerable experience in complex cases. I think this was the key point to gain global experience and bring it back to India, because these diseases are less known in India but not less prevalent. So it was the right time to bring this expertise to our country.
So, doctor, one aspect of performing a surgery is patient care. So, how do you deal with complex aortic cases, and how do you deal with patients?
See, apart from having the knowledge and skills, it's imperative to know that every aortic case that comes to us goes through extensive pre-operative planning. We strategize every patient pre-operatively, during the operation, what needs to be done, post-operative planning. So planning includes 80% of our work, and then the execution is the rest of it. So most of the planning is done before the surgery, and we know what we are getting into. We are prepared with plan A, B, and C. If there is a situation where we are not able to execute a particular plan, surgical plan, we always have a backup. So extensive planning, teamwork. We have some excellent team that we have put together here at Apollo Aortic Program, where we have other surgeons, senior anesthetists, along with nursing staff and excellent ICU care as well. So that all put together, we are able to provide world-class aortic care here at Apollo.
Very well, doctor. You mentioned about teamwork. So, I would want to understand, how do you collaborate with other medical professionals in managing aortic conditions?
As I mentioned earlier, that aortic diseases are multisystemic. It not only involves the disease of the blood vessel, but also diseases of the brain and kidney. So what happens is, every time a patient comes to us with complicated aortic problems, we do consult with other specialists related to particular organs, and we all work in collaboration to bring the best results and to bring the best possible care to these patients.
You provide care to these patients, but any preventive measures that you would want to talk about in aortic health, and how would you educate patients about it?
Absolutely. Aortic diseases are more commonly seen in patients who smoke, who have chronic hypertension or high blood pressure, diabetic, who are obese, and who have family history. So first and foremost, I would like to highlight the importance of knowing your family history. Know about your family members who've had aortic problems, or who've had undergone aortic valve surgeries, or if somebody has had sudden death in the family. So it's important to know your family history. Along with this, uh, we have numerous modifiable risk factors, that are smoking and diet and obesity, where if we quit smoking, we dramatically reduces the incidence of having aortic aneurysms. And we also, by maintaining adequate weight, we maintain good health, and that doesn't put unnecessary stress and strain on the body. And of course, diabetes and hypertension are very commonly seen in India right now, and it's very important to detect these early, and they can be modified with diet and exercise before going on pills. So it's very important to pay a lot of attention to our own health, which is quite often neglected in this busy world. That's the best way to prevent any catastrophic aortic diseases. Another important point is, if you are 35 and above and you have any of these risk factors, it's important for you to undergo a cardiac screening, which includes echocardiogram, ECG, and these echocardiograms can easily pick up any kind of aortic problems or aortic valve problems.
So, doctor, we talked about screening. I would want to understand that how often should one go undergo a screening or a test related to this?
If you have risk factors like the ones I mentioned, then it's important to get the screening done after 35. You have to get one screening done, and if you do not have any kind of issues underlying, then in 2 years you can repeat the screening, and after 5 years, every year to have a cardiac screening is definitely important and helpful.
Lastly, doctor, one message for our viewers to ensure good heart health.
Pay attention to yourself, pay attention to your health. Always give importance to what you eat. Watch your lifestyle, quit bad habits. Although it is a very common motto to keep saying quit bad habits, but it's very imperative, and we cannot emphasize enough. Every single cardiac patient of ours has any of these risk factors. So it's a proven thing that these bad habits that we have will surely get us into the hospital. So the sooner you quit, the better it is. Listen to your body, what it says. If you're under stress, strain, give yourself some time, spend some time to rejuvenate yourself, and pay attention to your heart.
Pay attention to your heart is what doctor said. Thank you so much for your time, doctor. And this session was really insightful. Thank you.
Thank you.